Good morning, everyone. Dr. James Whittaker here. And today we're going to talk about something that's silently sabotaging the health of millions of people over 50, yet almost no one recognizes it's happening until serious damage has already been done. I'm talking about chronically elevated cortisol, often called the stress hormone, and its devastating effects on your body, your mind, and your quality of life. Now, before you think this is just another video about stress management with the usual advice to meditate and take deep breaths, let me tell you this goes much deeper. What I'm about to share with you are the physiological mechanisms by which elevated cortisol literally accelerates aging, destroys your metabolism, shrinks your brain, weakens your immune system, and sets you up for chronic disease. More importantly, I'm going to give you 5 specific, scientifically proven strategies to lower your cortisol levels starting today. Strategies that go far beyond the superficial advice you've heard before. Before we dive into the details, if you're new to this channel, welcome. I'm a board-certified physician who spent over 2 decades helping patients optimize their health, and I create these videos to give you the information that most doctors simply don't have time to explain in 15-minute appointments. If you find value in what we discussed today, please hit that subscribe button and turn on notifications because this information could literally add years to your life and life to your years. Now, let me start by telling you about a patient I'll call Michael. Michael was 62 years old when he came to see me, complaining of stubborn weight gain around his midsection despite eating less and exercising more. He was exhausted all the time. His sleep was terrible. His blood pressure was creeping up. His blood sugar was heading toward diabetic territory. And he told me he just didn't feel like himself anymore. He'd been to 3 different doctors who all told him essentially the same thing. You're getting older. This is normal. Here are some medications to manage your symptoms. But Michael wasn't satisfied with that answer, and he was right not to be. When I ran comprehensive labs, including cortisol testing, we discovered that Michael's cortisol levels were significantly elevated, particularly in the evening when they should have been low. This single finding explained virtually every symptom he was experiencing. Over the next 6 months, we implemented the exact strategies I'm going to share with you today, and the transformation was remarkable. Michael lost 35 pounds without extreme dieting. His energy returned, his sleep improved dramatically, his blood pressure normalized, his blood sugar came back into healthy range, and he told me he felt like he'd turned back the clock 10 years. That's the power of addressing cortisol dysfunction. Let me know in the comments below what country you're watching from. I'm always fascinated to see our global community, and your engagement helps more people find this life-changing information. Now let's start with understanding exactly what cortisol is and why it matters so profoundly, especially as we age. Cortisol is a hormone produced by your adrenal glands, small organs that sit on top of your kidneys. Under normal circumstances, cortisol follows a predictable daily rhythm. It should be highest in the morning shortly after you wake up, giving you energy and alertness to start your day. Then it should gradually decline throughout the day, reaching its lowest point in the evening and during sleep. This natural rhythm is called your circadian cortisol pattern, and when it's functioning properly, it supports healthy energy, metabolism, immune function, and sleep. Cortisol serves many important functions in your body. It helps regulate blood sugar by signaling your liver to release glucose into your bloodstream. It modulates your immune system, preventing excessive inflammation. It influences how your body metabolizes proteins, carbohydrates, and fats. It affects blood pressure through its effects on blood vessel tone. And it plays a crucial role in your stress response, helping you deal with physical and psychological challenges. In acute situations, cortisol is life-saving. When you face a genuine threat, cortisol helps mobilize energy, sharpen focus, and prepare your body for action. This is the famous fight or flight response, and it's been essential for human survival for millennia. The problem arises when cortisol remains elevated chronically, day after day, month after month, year after year. This is what's happening to millions of people over 50, and the consequences are devastating. Here's what chronic cortisol elevation does to your body, and I want you to really understand this because it explains so many seemingly unrelated health problems that you might be experiencing right now. First, chronically elevated cortisol directly causes abdominal fat accumulation. Cortisol activates enzymes in your fat cells, particularly in visceral fat around your organs, that promote fat storage. At the same time, it breaks down muscle tissue to provide amino acids for glucose production. So you're simultaneously losing muscle and gaining belly fat, which is exactly the body composition change that most people over 50 struggle with. This isn't just about appearance. Visceral fat is metabolically active and produces inflammatory compounds that increase your risk for heart disease, diabetes, and cancer. Second, chronic cortisol elevation creates insulin resistance, meaning your cells stop responding properly to insulin's signal to take up glucose from your bloodstream. Your pancreas then has to produce more and more insulin to achieve the same effect, leading to chronically elevated insulin levels. This combination of high cortisol and high insulin is perhaps the most fattening, disease-promoting, hormonal environment possible. It practically guarantees weight gain, particularly around the middle, and sets the stage for type 2 diabetes. Third, elevated cortisol suppresses your immune system. While acute cortisol helps modulate inflammation appropriately, chronic elevation weakens your body's ability to fight infections and may even increase cancer risk by impairing immune surveillance. This is why people under chronic stress get sick more often and take longer to recover. Fourth, cortisol directly damages your brain, particularly an area called the hippocampus, which is crucial for memory formation and emotional regulation. Studies using brain imaging have shown that people with chronically elevated cortisol actually have smaller hippocampal volume. This contributes to memory problems, difficulty learning new information, and increased risk for depression and anxiety. It may also accelerate cognitive decline and increase dementia risk. Fifth, chronic cortisol elevation disrupts your sleep architecture. While cortisol should be low at night to allow deep restorative sleep, many people with cortisol dysfunction have elevated evening cortisol that makes it difficult to fall asleep or causes frequent waking during the night. Poor sleep then further elevates cortisol the next day, creating a vicious cycle. Sixth, elevated cortisol raises blood pressure through multiple mechanisms, including increasing the sensitivity of blood vessels to constricting signals and promoting sodium retention. This contributes to hypertension and cardiovascular disease risk. Seventh, cortisol directly affects your sex hormones. In men, chronic cortisol elevation suppresses testosterone production. In women, it can disrupt estrogen and progesterone balance. This contributes to low libido, erectile dysfunction in men, and various hormonal symptoms in women. And finally, chronic cortisol elevation accelerates biological aging at the cellular level by shortening telomeres, the protective caps on the ends of your chromosomes. Shorter telomeres are associated with shorter lifespan and earlier onset of age-related diseases. So you can see, elevated cortisol isn't just about feeling stressed, it's a systemic problem affecting virtually every aspect of your health. Now here's what most people don't understand and what most doctors don't adequately address. The causes of chronic cortisol elevation in modern life are multifactorial, and addressing them requires a comprehensive approach, not just telling someone to relax or meditate. Let me walk you through the major drivers of cortisol dysfunction, particularly in people over 50. First and most obviously, chronic psychological stress. Whether it's work pressure, financial worries, relationship conflicts, caregiving responsibilities, health concerns, or the accumulated weight of life's challenges, ongoing psychological stress keeps your cortisol elevated day after day. Your body can't distinguish between a genuine physical threat and a worried thought about your retirement savings. It responds to both with cortisol release. Second, poor sleep or insufficient sleep. This is bidirectional. Cortisol disrupts sleep, and poor sleep elevates cortisol. Many people over 50 are caught in this vicious cycle without realizing it. Third, chronic pain and inflammation. Any ongoing inflammatory condition, whether it's arthritis, autoimmune disease, chronic infections, or metabolic inflammation from obesity, keeps cortisol levels elevated as your body attempts to manage the inflammation. Fourth, excessive exercise or exercise without adequate recovery. While moderate exercise is healthy and actually helps normalize cortisol patterns, excessive training, particularly intense cardio, without sufficient rest and recovery, chronically elevates cortisol. I see this particularly in people who dramatically increase their exercise in an attempt to lose weight, not realizing they're making their cortisol problem worse. Fifth, calorie restriction and chronic dieting. When you eat too little, particularly if you're combining it with intense exercise, your body perceives this as a starvation threat and elevates cortisol to mobilize energy stores. This is one reason why aggressive dieting often backfires, causing muscle loss, metabolic slowdown, and eventual weight regain. Sixth, caffeine consumption, particularly excessive amounts or consumed late in the day. Caffeine directly stimulates cortisol release, and many people are consuming it all day long, keeping cortisol artificially elevated. Seventh, blood sugar instability. When your blood sugar drops too low between meals, your body releases cortisol to bring it back up. If you're skipping meals, eating a high-sugar diet that causes blood sugar swings, or not eating enough protein and fat to stabilize blood sugar, you're triggering cortisol release multiple times throughout the day. Eighth, certain medications including corticosteroids like prednisone, obviously, but also some blood pressure medications, hormone treatments, and even chronic use of stimulants. And finally, underlying health conditions including sleep apnea, which fragments sleep and causes oxygen desaturation that triggers cortisol release, thyroid dysfunction, which affects metabolism and stress response, and adrenal disorders, though these are relatively rare. Understanding these causes is crucial because it tells you where to focus your intervention. Now let's get to the practical part. The 5 strategies that actually work to lower cortisol and restore healthy patterns. These aren't generic stress management tips. These are specific evidence-based interventions that I use with my patients with remarkable results. Strategy number 1, master your sleep, because this is the foundation everything else rests on. Poor sleep is both a cause and consequence of elevated cortisol, and you cannot fix cortisol problems without fixing sleep. Here's what this means. Practically, you need to establish a consistent sleep-wake schedule, going to bed and waking up at the same time every single day, including weekends. Your body's circadian rhythm, which governs cortisol patterns, relies on consistency. Your bedroom environment must be optimized. Complete darkness is crucial because even small amounts of light suppress melatonin and can disrupt cortisol patterns. Use blackout curtains or a sleep mask. Cool temperature, ideally between 65 and 68 degrees Fahrenheit, promotes deeper sleep. And remove all screens and electronic devices, both because of the blue light they emit and because of the stimulation they provide. Your evening routine needs to support cortisol decline. This means no screens for at least 1 hour before bed because the blue light they emit suppresses melatonin and can keep cortisol elevated. Consider reading, gentle stretching, or conversation instead. Avoid intense exercise within 3 hours of bedtime, as it temporarily raises cortisol, and avoid large meals close to bedtime, though a small protein-rich snack can actually help stabilize blood sugar overnight. If you're waking frequently during the night, this often indicates blood sugar drops that trigger cortisol release. A small snack before bed containing protein and healthy fat, such as a handful of nuts or a hard-boiled egg, can prevent this. Some of my patients do remarkably better simply by adding this nighttime snack. Consider magnesium supplementation in the evening. Magnesium promotes relaxation, supports healthy cortisol patterns, and improves sleep quality. I typically recommend 300 to 400 milligrams of magnesium glycinate taken an hour before bed. If you have documented sleep apnea, get it treated. CPAP therapy can dramatically improve cortisol patterns by eliminating the oxygen desaturations and stress responses that occur throughout the night. Michael, the patient I mentioned earlier, had undiagnosed sleep apnea, and treating it was a game changer for his cortisol levels and overall health. Strategy number 2, strategic exercise, not more exercise. This surprises many people because we've been told that exercise reduces stress, and it does when done correctly. But excessive exercise, particularly chronic cardio, actually elevates cortisol chronically. Here's the approach that works. Prioritize strength training over cardio. Resistance training, particularly with adequate rest between sessions, helps build muscle, improves insulin sensitivity, and when done properly, doesn't chronically elevate cortisol the way long endurance training does. I recommend 3 to 4 sessions per week of full body strength training, focusing on compound movements like squats, deadlifts, presses, and rows. Keep your cardio short and intense, or long and easy, but avoid the middle ground. High-intensity interval training, true HIIT, sessions of 20 minutes or less, can actually improve cortisol patterns when not done excessively. Alternatively, long, slow walks are excellent and don't elevate cortisol. What you want to avoid is that moderate intensity zone, like 45-minute jogs or spin classes, done repeatedly throughout the week. This chronically elevates cortisol without providing the benefits of true high intensity or the recovery benefits of low intensity. And this is crucial. Build in adequate recovery. Your body adapts and grows stronger during recovery, not during the workout itself. If you're training hard every day with no rest, you're keeping cortisol chronically elevated and undermining your health. Most people over 50 do best with 3 to 4 days of structured exercise per week, with the remaining days devoted to gentle movement like walking or stretching. Add stress-reducing movement practices. Yoga, Tai Chi, and Qigong have all been shown in research studies to reduce cortisol levels. These practices combine gentle movement with breathwork and mindfulness, addressing stress on multiple levels. Even 15 to 20 minutes daily can produce measurable improvements in cortisol patterns. Strategy number 3, nutritional strategies that directly lower cortisol. What you eat, when you eat, and how much you eat all profoundly affect your cortisol levels. Let me give you the specific approach. Stabilize your blood sugar. This is perhaps the single most important nutritional strategy for cortisol management. Every time your blood sugar drops too low, your body releases cortisol to bring it back up. If you're eating in a way that causes blood sugar to spike and crash repeatedly throughout the day, you're triggering cortisol release over and over. The solution is to eat balanced meals that combine adequate protein, healthy fats, and fiber-rich carbohydrates. Protein should be present at every meal, ideally 30 grams or more for meals. Healthy fats like olive oil, avocado, nuts, and fatty fish help slow digestion and stabilize blood sugar. And when you eat carbohydrates, choose fiber-rich sources like vegetables, berries, and whole grains rather than refined sugars and starches. Eat regularly and don't skip meals. Going too long between meals causes blood sugar to drop and cortisol to rise. Most people do best eating every 3 to 4 hours during waking hours. This doesn't mean constant snacking on junk. It means structured meals and possibly 1 or 2 planned snacks. Reduce or eliminate caffeine, particularly if you're already experiencing cortisol-related symptoms. Caffeine directly stimulates cortisol release and can disrupt your natural cortisol rhythm, particularly if consumed in the afternoon or evening. If you're not ready to give up coffee entirely, limit yourself to 1 cup in the morning and switch to decaf or herbal tea after that. Consider adaptogenic herbs. Certain herbs called adaptogens have been shown in research to help modulate cortisol levels and improve stress resilience. Ashwagandha is perhaps the best studied, with multiple trials showing it can reduce cortisol levels and stress symptoms. Typical dosing is 300 to 600 milligrams daily of a standardized extract. Rhodiola rosea is another adaptogen with good evidence for stress reduction and cortisol modulation. Holy basil, also called tulsi, has been used traditionally for stress and shows promise in modern research. And phosphatidylserine, while not technically an adaptogen, has been shown to blunt cortisol elevation in response to stress. I often recommend these to patients as part of a comprehensive approach, though they're not magic bullets on their own. Ensure adequate vitamin C intake. Your adrenal glands have the highest concentration of vitamin C in your body, and vitamin C is required for cortisol production and regulation. Some research suggests that vitamin C supplementation can help normalize cortisol patterns, particularly during periods of high stress. Consider 1,000 to 2,000 milligrams daily in divided doses. Omega-3 fatty acids from fish oil have been shown to reduce cortisol elevation in response to stress and to reduce inflammation that can drive cortisol elevation. I typically recommend 2 to 3 grams daily of combined EPA and DHA from a high-quality fish oil supplement. And don't underestimate the importance of adequate caloric intake. If you're chronically undereating, particularly if you're combining it with intense exercise. You're telling your body it's in a famine state, which elevates cortisol. This is especially problematic for people over 50 who are trying to lose weight through severe calorie restriction. A more moderate approach that doesn't trigger the starvation response is far more effective long-term. Strategy number 4, master your stress psychology, not through generic relaxation advice, but through specific practices that have been proven to lower cortisol. First, practice gratitude daily. Research shows that regularly acknowledging things you're grateful for measurably reduces cortisol and improves well-being. This isn't just positive thinking, it's a psychological intervention with physiological effects. Each evening before bed, write down 3 specific things you're grateful for from that day. The practice takes 3 minutes and the cumulative effect over weeks and months is substantial. Second, use breath work strategically. Your breath is the most accessible tool you have to directly influence your nervous system and cortisol levels. When you're stressed, your breathing becomes rapid and shallow, which maintains the stress response. Deliberately slowing and deepening your breath activates your parasympathetic nervous system and reduces cortisol release. Here's a specific technique that works. Breathe in slowly through your nose for a count of 4, hold for a count of 4, breathe out slowly through your nose or mouth for a count of 6, and hold for a count of 2. Repeat this. Cycle for 5 minutes. The extended exhale is key because it activates the vagus nerve and promotes relaxation. Do this at least twice daily, once mid-morning and once mid-afternoon, to interrupt cortisol elevation. Third, establish boundaries around technology and information consumption. The constant barrage of news, emails, social media, and notifications keeps your nervous system in a state of activation. Your brain perceives each notification, each alarming headline, each work email as a potential threat requiring attention, and responds with cortisol release. Set specific times to check email and news rather than leaving notifications on all day. Remove social media apps from your phone, or at least disable all notifications. Create phone-free zones and times, particularly the first hour after waking and the last hour before bed. This allows your cortisol to follow its natural pattern rather than being artificially elevated by digital stimulation. Fourth, cultivate social connection. Strong social relationships are one of the most powerful buffers against chronic stress and cortisol elevation. Regular, meaningful interaction with friends and family measurably reduces cortisol. Loneliness and social isolation, conversely, chronically elevate cortisol and are associated with numerous health problems. If you're isolated, make rebuilding social connection a health priority, just as important as diet and exercise. Join groups, volunteer, reconnect with old friends, invest in family relationships. The health benefits are enormous. And fifth, consider working with a therapist or counselor if you're dealing with ongoing psychological stress, unresolved trauma, or chronic anxiety. These aren't character weaknesses, they're health conditions that respond to treatment. Cognitive behavioral therapy in particular has been shown to reduce cortisol levels in people with chronic stress. Strategy number 5. Consider time-restricted eating, also known as intermittent fasting, but with an important caveat. When done correctly, time-restricted eating can help normalize cortisol patterns and improve metabolic health. The approach that works best for cortisol management is eating within an 8 to 10 hour window during the day, typically from mid-morning to early evening, and then fasting overnight. This aligns your eating with your natural circadian rhythm and cortisol pattern. For example, if you eat your first meal at 8 or 9 in the morning and finish your last meal by 6 or 7 in the evening, you're creating a 14 to 16 hour overnight fast. This extended fasting period allows cortisol to decline naturally in the evening, promotes better sleep, and gives your digestive system a rest. However, and this is crucial, this only works if you're eating adequate calories and nutrients during your eating window. If you combine time-restricted eating with severe calorie restriction, you'll actually worsen cortisol elevation. The goal is not to eat less overall, but to eat your normal healthy amount within a condensed time window. Some people, particularly women, and particularly those already under significant stress, may find that even this approach elevates their cortisol. If you try time-restricted eating and find yourself feeling more anxious, sleeping worse, or experiencing increased cravings, it may not be right for you at this time. Listen to your body and adjust accordingly. Now let me bring this all together with Michael's story. When Michael came to see me with stubborn weight gain, fatigue, poor sleep, and declining health markers, we implemented all 5 of these strategies systematically over 6 months. We started with sleep optimization. Michael had undiagnosed sleep apnea, so we got him evaluated and started on CPAP therapy. We established a consistent sleep-wake schedule and optimized his bedroom environment. Within the first month, his sleep quality improved dramatically. We adjusted his exercise approach. Michael had been running 4 to 5 miles every morning in an attempt to lose weight. We cut that back to 3 days per week of moderate-length runs and added 3 days of strength training. We also added a daily evening walk with his wife. He was initially skeptical that exercising less would help, but within weeks he noticed improved energy, and his weight actually started dropping. We overhauled his nutrition. Michael had been skipping breakfast and eating a large dinner late in the evening, which was maintaining high evening cortisol. We shifted to 3 balanced meals, starting with a protein-rich breakfast, eliminated his afternoon caffeine habit, and moved dinner to 6 p.m. We added magnesium and fish oil supplementation, and I started him on ashwagandha. We implemented stress management practices. Michael committed to 5 minutes of breath work twice daily, started a gratitude journal, and set boundaries around his work email checking. He also reconnected with a group of friends he'd drifted away from, resuming weekly golf outings that provided both social connection and gentle exercise. And we implemented a 12-hour eating window, roughly 7 a.m. to 7 p.m., which aligned with his natural rhythm and improved his evening cortisol decline. The results were remarkable. Within 3 months, Michael had lost 20 pounds, most of it from his midsection. His energy was dramatically improved. His sleep quality had transformed. His blood pressure normalized without medication. His fasting blood sugar came down from pre-diabetic to normal range. And perhaps most importantly, he reported feeling like himself again, with improved mood, mental clarity, and overall vitality. When we retested his cortisol at 6 months, his pattern had normalized, with appropriate morning elevation and low evening levels. Michael's transformation wasn't the result of a single intervention. It was the cumulative effect of addressing multiple aspects of his physiology and lifestyle systematically. That's what it takes to truly resolve cortisol dysfunction. Before we wrap up, I want to address testing because many of you will be wondering whether you should have your cortisol measured. The standard cortisol test that most doctors order, a single blood draw in the morning, is nearly useless for identifying the patterns we've been discussing. A single morning cortisol may be normal even when your overall pattern is dysfunctional. The best test for evaluating cortisol patterns is a 4-point salivary cortisol test, where you collect saliva samples at 4 specific times throughout the day, upon waking, mid-morning, late afternoon, and before bed. This reveals your cortisol rhythm and identifies patterns like elevated evening cortisol or blunted morning cortisol that a single blood test would miss. Many functional medicine doctors and some integrative practitioners order this test routinely. It's not typically covered by insurance, but is relatively affordable out of pocket, usually between $100 and $200. If you're experiencing symptoms suggestive of cortisol dysfunction, stubborn weight gain particularly around the middle, fatigue despite adequate sleep, difficulty falling or staying asleep, increased anxiety or irritability, poor exercise recovery, frequent illness, brain fog, or blood sugar problems, this testing can provide valuable information to guide treatment. However, even without testing, implementing the strategies I've outlined today will benefit virtually everyone and carry essentially no downside risk. Let me summarize the key points. Chronically elevated cortisol is devastating to your health, accelerating aging, promoting weight gain and metabolic dysfunction, damaging your brain, suppressing your immune system, disrupting your sleep, and increasing disease risk. The causes are multifactorial, including psychological stress, poor sleep, inflammatory conditions, excessive exercise, calorie restriction, caffeine, and blood sugar instability. Addressing cortisol requires a comprehensive approach targeting multiple systems simultaneously. The 5 key strategies are: optimize sleep with consistency, darkness, cool temperature, and evening routine. Implement strategic exercise emphasizing strength training, adequate recovery, and stress-reducing movement. Stabilize blood sugar, eat adequate protein and healthy fats, reduce caffeine, and consider adaptogenic herbs. Master stress psychology through gratitude, breath work, technology boundaries, and social connection. And consider time-restricted eating aligned with your circadian rhythm. These strategies work synergistically, each one enhancing the effects of the others. And the benefits extend far beyond just cortisol, improving virtually every aspect of your health and quality of life. I want to hear from you in the comments. What symptoms of elevated cortisol are you experiencing? Which of these strategies are you going to implement first? What questions do you have about managing stress and cortisol? Your engagement helps me create content that serves you better. If you found this information valuable, please hit that like button so more people can find this life-changing information. Subscribe to the channel and turn on notifications because next week, I'm going to discuss testosterone optimization for men over 50, including what actually works and what's just marketing hype. That's a video you definitely don't want to miss. Check out my playlist on metabolic health and hormone optimization. There are several videos there covering topics related to what we discussed today, all approached with the same evidence-based, actionable perspective. As always, the information in this video is for educational purposes only and should not replace individualized medical advice from your own healthcare provider. Thank you for watching, and I'll see you in the next video where we continue exploring how to optimize your health and vitality at any age. Take care.